authorizations, approvals, referrals, so much confusion. Let's investigate, shall we? Welcome, I am Martin Bruce, your medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing the answers, insights, and solutions to empower patients like you. So let's go over the basics. What does it mean? How does it work? When should you request one? And last, some tips to help you along. So what's the difference? Basically, authorization, referral, and approval all mean the same thing. It is the written promise by your insurance to cover a specific service or item that your doctor ordered. It means peace of mind for you. And for the provider of service, they will know in advance what will be covered and at what rate. I have found that there is a distinction between HMO and PPO wording, and for more on that specific topic, do watch my video. PPO, HMO, what the heck? In an HMO setting, a referral usually means that your PCP, primary care physician, has recognized the need for and authorized a medical service to be delivered by a different medical provider. In the PPO setting, an authorization is a promise of payment per the terms listed on that document and based on a decision from a nurse at the insurance or external medical reviewer, but not your doctor. Pre-authorizations mean before the fact, retro means after services were rendered. So when should you be concerned about having one? Well, your HMO pretty much requires one for every service except for simple visit with your PCP. Anything from a prescription to a visit to a specialist or a surgery. PPO plans are more relaxed. Usually only expensive stuff for inpatient services require one. Why are authorizations even needed, you ask? Well, some say it's for your welfare, others because of the insurance bottom line. I'll let you decide. So that authorization, referral, approval places the burden on your insurance to pay down the line, but your premiums must be up to date and you must be eligible at the time of service. As for the requested procedure or medical service, the provider of service and place of service, the diagnosis or reason for the service, the date range, and the general circumstances. The initial request must match the approval's details. For example, let's say Ozempic was approved based on your type 2 diabetes, but it is used for and billed for weight loss. Payment will be denied. First, the FDA did not approve Ozempic for that weight loss, but also the diagnoses are completely different. 12 sessions of physical therapy were approved for your sprained shoulder, but it took 15 sessions. Well, 3 will be denied because an extension should have been requested. An abdominal exploratory surgery was approved, but something serious develops that must be treated right then. The authorization will be applied and payment will be made. It's the same area of the body, and what eventually is billed is the direct result of a requested procedure. So how does it all work? For HMO patients, either you, a doctor you have already been seeing, or circumstances, including emergency, requires a request be sent to your PCP, and your primary care physician can then decide to treat you himself or herself, can approve a request or deny it altogether. PPO patients, the process is the same, except it's not your own physician reviewing the case, but the insurance nurse or an external doctor. Decisions are made on medical records and the insurance's medical policies. So it is either approved or denied, but sometimes it can be conditionally approved. That means it's basically okay, but you must go to a different specific provider or a change must be made. For example, switching from brand name to generic. Now, there are these special times when I would advise to request a special authorization to save you money. If you have a new plan or a new insurance company, but your current treating physician is not contracted with it, request a continuation of care authorization. Your out-of-network services could then be covered at the higher in-network rate. This is especially true if you are in the middle of a treatment such as chemotherapy or whenever a delay could be harmful. Do watch my special video on in and out of network. If you require a specific treatment or have very special medical needs and no in-network provider is able, willing, available, or qualified, you should request an in-for-out or waiver authorization. So your out-of-network services could also possibly be covered at the higher in-network rate. As for off-label authorizations, your medical provider should best request those as they must provide solid documentation justifying the need, efficacy, and safety of something the FDA has not approved. And last, some helpful tips. Emergencies do not require authorizations per federal law and per most terms of coverage. Some states like California even have laws that force insurance companies to pay once an authorization has been issued pretty much no matter what. Now, a denial does not mean you have no rights or recourse. There is an appeal process detailed in your policy and usually on the initial decision letter. It may include a review by an external clinician not paid by your insurance. Because let's not forget, we patients have rights, insurance companies have a duty to their members, and providers have rules they must follow. I so thank you for watching. Your likes, subscribes, and comments help this channel grow to reach out to many more patients like you. So thank you.